Good morning, you're through to the NHS 111 service. My name's Debbie, I'm a call handler. Could I start by taking the number you're calling from, please? Yeah. Thank you. That's 01332 123 489. Can I take the patient's first name, please? Thank you. And date of birth, please? You're telling me you've got abdominal pain this evening? Thank you. Have you been bringing up blood at all? Okay.
I think the benefits of the 111 service is a very easily remembered number for patients to ring. It's a convenient service for patients, and it should ensure that they get the right care first time rather than having to access several services before they get the care that they need. The 111 service is governed at 3 levels. We have our local clinical governance group, which scrutinises the service. That then feeds into a regional group, which is across the East Midlands, and finally up at a national level, where I sit on the National Clinical Leads group, and where we discuss many of the issues that are common across the country. In my view, the service is safe. The clinical support system that underpins the service is very robust. It makes sensible, safe decisions. The key to the service is the quality of the call handlers and how well they talk to patients and ensure that they get the right answers to the questions that are asked. I think we're very lucky to date in Derby in that we have got some excellent call handlers. The 111 service can make a difference to the quality of care in 2 ways. Firstly, by ensuring that the patient gets the right care first time, and secondly, the service can also identify gaps in the wider urgent care services in Derbyshire. So where maybe a service doesn't exist for patients in an effective way at the moment, that can be procured in the future. In order to become a 111 pilot site, we had to satisfy the Department of Health on 2 levels. Firstly, that technically the local service would be able to handle the volume of calls and technically work the system. And secondly, that there was a high level of clinical governance locally, that we could ensure that the service that is provided here is both safe and provides appropriate care for patients. The 111 service has, in my view, a higher level of scrutiny than any other clinical service currently provided. And my role as clinical lead for the service is to ensure that there is external scrutiny of the quality of care that is provided by the service. I think the external scrutiny here is extremely important and brings a level of rigour that isn't always attached to other services locally. At the local call reviews, we have representatives from the provider of the service, we have local stakeholders such as the ambulance service and the local medical committee, and we have external scrutiny from myself and others. At the call review, we listen to a range of calls in terms of calls where there have been significant incidents, complaints, where there has been feedback from professionals such as East Midlands Ambulance or from local GPs, and in some cases random calls to ensure the quality of calls are appropriate. We try and identify the learning from these calls. For example, in some cases there are problems with the clinical support service system that needs a tweak at a national level, and in some cases there needs feedback to the call handler where that might result in a little bit of improvement in the quality of the responses from the call handlers themselves. I think my greatest learning is that while the local system works very well, the quality of the call handlers and how well they relate to the patient is the key element, and I think we're quite lucky with the quality of call handler that we have in Derby. In terms of improving the urgent care pathway, it's really too early to expect any changes. The service has only been up and running for a few months, but I see in the longer term that much better integration of the urgent care services is one of the key successes that we'll be looking for in the future. My experience of the 111 service to date is it's been fascinating. I think we've seen much greater call volumes than even the Department of Health were anticipating. I think we've had high levels of satisfaction from patients. The level of activity for in-hours primary care has been very minimal to date, and I know that was one of the concerns that many of my colleagues have had. I've been struck by the enthusiasm and the desire of everyone to make this a great success for Derbyshire, and I'm very confident that it will be in the long term.
In our telephone survey conducted by health panel members, 63% rated the 111 service 5 out of 5.
The 111 person gave reassurance and advice on what action to take. They listened carefully.
Very efficient and quick.
A prompt response for what was needed.
Easy, convenient, got us to where we needed to be.
A good experience, very smooth and professional.
Everything is perfect, seen within an hour, easy number to remember.
A lot of the positive things that were said, we do want to keep these in the 111 service moving forward. Things like being able to send for an ambulance when it's felt appropriate, setting up appointments at other facilities where appropriate, so that the patient hasn't got to do that themselves. The 111 service needing to be flexible enough to respond to the specific needs of the caller, not having to wait, for example, in A&E, but being able to go somewhere more local to sit and wait for the necessary treatment, so that they're signposted to a facility much nearer to where the caller is from.
Looking at the results from all these telephone surveys, I mean, there are some people who have obviously had a bad experience with it, but what I find most heartening is the fact that overall most people are highly satisfied with it, and the number of sort of people who think it's excellent and the comments very good, can't improve, is really quite heartening. To say that it is a pilot and we're learning things all the way through.
This is the first evaluation of the system since it began, and we are interested in any ongoing evaluation of the system as it progresses and takes over the whole of the country, eventually, of course. The one or two negatives include that callers would like a sense of how long they may need to wait at the service they've been signposted to.
I think in the current setup there is quite tight evaluation. I think what we're saying is, please, that must continue,
yes,
so that we continue to get feedback and it doesn't just stop at the pilot.
Looking at some of the negative feedback from the calls that we've had time to listen and speak to members of the public about, there's been this continuing issue. Patients are often wanting to say right at the beginning of when they've telephoned 111 what they believe is wrong with them, not having to answer this long series of questions. I think sometimes if they've been in a lot of pain, they've found it difficult to respond to all these questions that have been bombarding them with from the 111 call operative. And that's led to a lot of frustration as we've been ringing people to see what their patient experience has been.
Yes, the problem is, though, I think, that you've got to have certain information. People are ringing out of the blue, and as the call handler of the 111 service, you need to know who they are, where they are. So you have got to go through a certain amount of information so that you can react if something drastic happens. I suppose that's where the reassurance comes in, and the tone of voice of the call handler as they are asking the questions, partly how they do it. Also, there's the question that has come out of this, which does ask the question, why do I have to repeat it if I phoned you half an hour ago or last week with a long-term problem? So I think that's an issue that perhaps should be addressed.
Hi, my name's Debbie. I'm one of the call handlers working for the 111 service. I do feel that the 111 service is a big improvement for the patients. All they've got to remember really is to call 111 and we'll take it from there. They don't need to remember where to go and things like that. We do get a variety of calls through the 111 service, ranging from patients that just want advice initially to patients that do need more immediate care. The training that to become a 111 call handler took approximately 2 weeks. Throughout the 2 weeks we did do quite a lot of exams, but it's still ongoing training as you're taking the calls. Each and every day is a different day.